tonight as we do continue our community engagement live webinars here tonight. My name is Cicely Fleming. I am the director of Birth to 5 Illinois, and I welcome you here tonight. We are going to be covering a variety of material tonight. Some you might have heard if you were at our kickoff session, so we appreciate your patience, but there is lots of new information as well tonight. Tonight's session will be recorded so that we can have it on our YouTube channel later. For anyone who was unable to attend and anyone you might want to share this information with later. For our Spanish speakers, we are also offering Spanish interpretation live tonight. I'm going to pause for a minute now to allow our interpreter to give you those directions.
Muy buenas noches a todos, yo me llamo Leticia. Vamos entonces ahora a dar las instrucciones del idioma en español. ¿Sí me escuchan? Entonces aquí vamos a dar.
Yes. We heard you and then we lost you.
I never heard anything on the English line, but maybe it was me.
Can you hear me now?
Yep.
Ok, perfecto. Hola, muy buenas noches. Mire, mi nombre es Leticia, su intérprete el día de hoy del idioma español. Si tienen una computadora, les voy a dar instrucciones cómo se pueden conectar. Si ven un globito en la computadora, toquen en la... ¿Sí me escuchas, Jess?
Yes.
Ok. Entonces, ahorita vamos a dar las instrucciones de cómo conectarse en el globo.
You're cutting in and out though.
Muy buenas noches. Mi nombre es Leticia. Mi nombre es Leticia.
I can go ahead and give the Spanish.
Okay, that would be great. Thanks, David.
If she's in the Spanish line. Hola, buenas tardes. Soy David Quiroz. Voy a dar unas instrucciones de cómo puedes unirte al canal de español si buscas esa interpretación. Si estás en tu teléfono, toca en cualquier parte de tu pantalla y va a ver los tres puntitos a la esquina de lo que es la esquina derecha de lo que es tu celular. Tocas allí, escoges Language Interpretation o interpretación de idiomas y escoges español. Eso te va a llevar al canal de español. Vas a ver arriba que dice finalizar, arriba de tu pantalla. Si estás aquí en la computadora a través de Zoom, es muy similar. También vas a ver la opción abajo, los tres puntitos y interpretación, después español y igual ahí te va a dar la opción de que te cambies a ese canal y no tienes que finalizar, se hace automáticamente de esa forma. Y creo que nuestro intérprete ya está allí en ese canal de español.
Thank you, David. There are also some written directions in the chat for folks who might need those. We also are providing closed captioning tonight. If you look on the screen, you can press the live transcript closed captioning button there at the bottom of the screen. The closed captioning is being auto-provided by Zoom tonight, so we apologize for any translation errors, interpretation errors. But as I said, this will be recorded and put online, and so you can also review the video. Tonight, we did decide to do a live webinar format versus an open Zoom town hall to make sure it's a high quality experience for everyone. And our goals tonight are simple. We want to introduce our state team to you all, share the work of our councils up to date, and also answer your questions. Some of the information tonight, as I said earlier, had been shared before us, but please be patient as there's lots of new information towards the end. The chat feature is open and you will see our staff dropping links in there and you're welcome to engage in there. But we do ask if you have any questions you would like answered tonight that they will go in the FAQ. You can find that button also at the bottom of your screen. Just type questions in there and we will answer them out loud as well as in the chat. We will take questions in the following order. First, people who submitted them using the registration form we provided online before tonight's event. Second, questions that are submitted in that Q&A box. And then last but not least, folks who are here tonight, if you have a question, please just press the raise your hand button. We can unmute you and answer your questions tonight. David is going to go over some questions that we've been getting from across the field. And so your question might be answered in David's presentation, but feel free to elaborate on any question you have that we did not address. Right, we're now going to get into our presentation. If we can go to slide number 1, please. Thank you. So since we've gathered and been charged with launching these regional councils, we realized we needed to have a vision and a mission that clearly stated what we're trying to do. And so our long-term goal here is reimagining a more equitable early childhood education and care system that ensures family and community voice is centered and prioritized at every level of decision-making in the state of Illinois. So it's a big goal, but as you'll see from our work, we're confident that we can do it with your partnership in the community, with parent leaders and community members. Next slide, please. No, it's there, sorry. Yep, our mission. Our mission is to create a statewide regional infrastructure that will amplify input from the communities in the development of policies and funding priorities. We will mobilize communities to build and sustain equitable access to inclusive, high quality early childhood services for all children and families throughout the state. Again, big goals, but we are confident that with your partnership, we can accomplish them. Next, we'll go over the values and the goals that we set up for our initiative. So you'll see family voice, racial equity, and collective impact are the 3 most important things and the values for our work here. For family voice, what we mean by that is through this transformation centered on authentic family and community engagement, we will address the inequitable distribution of resources and services and rebuild our state's early childhood education and care system. For racial equity, we describe that as our work in an effort to move our early childhood education and care system to one where race is no longer a predictor of child success. We will address barriers that have limited access to high quality service for all minoritized children in every corner of our state. And we are going to use a collective impact model. Birth to 5, Illinois will build a system that harnesses knowledge directly from families and mobilizes decision makers to ensure new and or expanded services are created to meet community needs and directly influence policy and funding at the local, regional, and state level. Next slide, please. All right, so who is Birth to 5? Some of you all might have met me or Sonia or Jess as some of the pioneers of this team. We've added on quite a few people and some are on the call now. We do have 2 calls going on at the same time, and so half of our team is on another call in case you don't see them here, but we are all fully committed to this work. So I introduced myself already as the director. We have Sonia, who is the director of operations. She's on another line now. We have Jess, who is on this line with us tonight as the project coordinator. Maggie, who is our communications manager, is also on another call tonight. Dina, as the family and community engagement manager with our team, on another call this evening. David is on our call tonight. You will hear from him later. He's a family community engagement coordinator. And Angela rounds out our team as the grants and relations manager and is actually on another call tonight. Next slide, please. So some of you all might have come to us from a variety of ways. Many might have come through us to our area coordinators. These people have been our boots on the ground, making sure that people understand the work of Birth to 5, also helping us to build our database, also doing all of our front-facing work into the community until we launch all the councils with the staff members. And we knew that was really important. So we wanted to find people who understood early learning and also understood their community. So Corrine covers area 1. I don't have a map to show you where these areas are, but that's okay. Let's see. Make my slide a little bigger. My eyes are going bad. Diana is area 2. Jackie is in area 3. Dana, who's on the line tonight and covers your area, area 4. Kim is area 5 and Lori is area 6. So as I said, they've been out in the field. You might have engaged with them. Dana, I'm sure, will drop her email in later in case you want to respond to something that she sent you already. But they're doing a lot of work and they'll be with our team throughout the end of this year. Next slide, please. All right, so what is Birth to 5 Illinois? We've refined this message a bit as we've heard from the community and make sure we can try to be as clear as possible. Birth to 5 is in partnership with the state of Illinois and INCRA, which is the Illinois Network for Child Care Research and Referral Agencies. They work together to build Birth to 5. Birth to 5 is tasked with creating the Birth to 5 action councils and family councils in each of the 39 regions in Illinois We are now working with Chicago to round out that 39. And so we can talk about that a little bit later. The councils will share geographic boundaries with the State Board of Education map that you see here using the Regional Office of Education maps. And so we will share that geographic boundary. However, our councils, both the Action Council and the Regional Council, will operate independently. As I mentioned a little bit before, Chicago had its own kind of regional council already established, Every Child Ready Chicago. So we are going to work and partner with them to make that alignment very smooth. So they will be the regional council for that area. And we will have all that information up at a meeting we're having, a public meeting on April 6th. You can look at our website if you want more information about that. There are several important goals about the work of Birth to 5. One is to support local residents and coming together to address early childhood needs within their own community. So that's the piece where we're bringing everyone to the table, even folks who aren't usually at the table for early learning, to make sure they're all committed and we can support their work. 2 is to make sure the state's policies and funding priorities match the needs of each region, prioritizing that authentic family engagement, provider voice, and community needs. And also to provide equitable access to high quality early learning services for all students throughout our state. So that's the work of our council overall. We welcome people. Oh, sorry, my computer is having some problems today. I'm sorry about that. We welcome people who are new to advocacy, people who have been advocates for a long time, parents who have just started using the early childhood system, parents and providers from all walks of early childhood to join us in this work because every voice is critical. We are currently in the process of hiring regional action council managers for all of the regions. Those jobs are listed on the INCRA website if you want to check those out and have some interest in applying or have someone that you want to apply. We also have 2 positions available for the Birth to 5 team that will round out our state team. Those are also available on the website and the link should be in the chat for you now. All right, I'm going to be handing it off to David now, who's going to take us through the next couple slides, and then we'll round out our meeting with some questions from you.
Great. Thank you, Cicely. Like I mentioned earlier, my name is David Kiras. I'm the Family and Community Engagement Coordinator with the Birth to 5 team. And we're going to start talking about the councils. We're going to break them up and we're going to start with the Action Council. So when thinking about the Action Council, we're looking for a wide variety of experiences within this council. They are listed here below, some of those roles, and I'll go over some of them, not all of them, but the first one you see there is parents and family members. So we are looking to have some family and parent representation in the Action Council. That is critical to the work that Birth to 5 is trying to do. So definitely want to point that out. Some of the other roles we're looking to have: local and county elected officials, healthcare employees, members of the faith community, childcare staff, local school districts, centers, really just kind of a nice mix of anyone in the region who has had experiences working in and being a part of that early childhood landscape. Okay, and you can find this list on our website as well. Next slide, please. Okay, so what will the Action Council do? So the Action Council is part of that leadership team, right? Providing the direction, the vision for the work of the region. So they're going to be identifying the gaps of early childhood in that region, the needs. They're going to amplify that family voice. They're going to work closely with local coalitions to support state and community goals that we have. Communicate regularly with the families, providers, communities, policymakers about the work that's happening inside of the council. They're going to connect with early childhood systems that are already in place and connect families to systems that are already in place, such as housing and healthcare systems. Work closely with us, the Birth to 5 Illinois State team, the Action Council staff for that region, as well as the Early Childhood Transformation team. One of the big things that they're going to be focusing on is a regional scan. So they're going to conduct a regional scan or a needs assessment for that region. And this will happen with input from the Family Council, which I'll go into in a little bit. They're going to create an annual report that makes recommendations to expand or create new services that are needed in that region as well. Next slide, please. Yeah, so who are we looking for that action council? What are some of those requirements? So really very simple. We want the work to happen with individuals who live or work in this area who have received early childhood services in the area. If someone lives in another area, we're encouraging them to apply for the city or county that they feel they would represent the best, that their contributions would have the greatest impact, right? Now, the Action Council is a volunteer leadership role. Wanted to make sure to mention that, as well as we do anticipate that the Action Council will meet about twice a month. Now, there may be some additional tasks outside of those 2 meetings. We do ask that Action Council members serve about 2-year commitment. There will be the option to commit for 1 year and then later an opportunity to continue into your 2nd year. Family members, and I mentioned this in the first slide when I spoke, family members who are in the Action Council, there will be a stipend for their time, for their experience, because again, that is the foundation of the work of Birth to 5. So we want to recognize that. So there will be a stipend for those members. Next slide, please. Great, so that's going to transition us right into the Family Council. So who are we looking for in the Family Council? We're looking for families with children under the age of 8 or have that experience in early childhood services in that region, right? That is going to be critical. We need that authentic parent engagement, and this is why this Family Council is so important. We are going to have around 15 members, or we're hoping to have around 15 members. And I don't know if I mentioned that for the Action Council, but Action Council as well, we're looking for about 15 members in each. We want a wide variety of diversity in both of these councils. We want to hit those priority populations that we maybe have not heard from in the past in the Family Council. And like I mentioned, children under the age of 8 or experience in early childhood, and 15 members. Next slide, please. Okay, so what is the work of the Family Council? They're going to serve as an advisory committee for the Action Council. They're going to be able to make some big differences for the families, for the children of that region. They're going to share input, get feedback, advocate for family needs, identify gaps, and raise issues of concern for the community, from the community to that Action Council. They are going to be the voice. Now, we're not going to capture all the families, obviously, in each of these regions. We're just looking to have about a group of 15. There will be an expanded group that we're going to be getting input from in different ways, from all to capture the picture of all the families who might be living in that region. But these are the main tasks that the Family Council will do. Next slide, please. And again, we want a wide variety of voices in the Family Council. We want the families to live across the entire region, again, especially in areas that have been under-resourced in the past. Families that represent the racial diversity of the region will be critical. Families, again, like I mentioned, at least 1 child under the age of 8 or experiences with early childhood services. We're looking for families to, again, have about family councils to have about 2 meetings per month with possible, outreach opportunities in between, outside of that. And again, a 2-year commitment with the opportunity to do 1 year and then continue on to your 2nd year. And I'll mention this again, Family Council members will receive a stipend for their time and experiences because that is crucial to the work we're trying to do. We do have a new flyer for the Family Council. I think Jess will be putting that in the chat here. Next slide, please. Okay, serving on the Birth to 5 selection. Yes, so the selection committee is something that we're also looking to fill and to kind of stand. This is a committee that's going to be helping us look through the interest forms for both the Action and the Family Council and making sure we're getting to that diversity that I talked about earlier. So some of the requirements for that, obviously local residents that reside in and have received services also in that region. One of the main things I want to make sure I mention, you have not applied for either of the councils. So this isn't as long of a time commitment, right? And then that 2 to 1 year, the options that we were talking about, this is more of a 2 to 3 week. Just as soon as we start hiring some of the staff in each of the regions, then we're going to be looking to fill these councils. That's where we're going to tap this selection committee to help us do that. So we're looking at 2 to 3 weeks once the applications close and we have some of that staff in place. This is a volunteer opportunity. And yeah, I think that's all I wanted to mention about the selection committee. Next slide, please. I think that's the last one for me. That is the last one for me. I'm going to pass it on to Dana now to talk to us about community collaborations and how we're going to be working with them.
Okay, thank you, David. Hi, everyone. I'm Dana David. I am the Area 4 coordinator for your region of the state, which is also my home region. So I recognize many names on our list tonight. First and foremost, as we come in and Birth to 5 ramps up, we are partnering with community collaborations, the work that you're already doing in our communities. We want to partner with you to help build capacity and share information that you have already been working on so that we can further the work that you are already doing. As we move forward, we want to be complementary in that work. We do not want to replace the work that you're doing. We do not want to duplicate it. Ultimately, our goal is to make the community work easier for everyone, create a new governance and funding model for early childhood education, one that actually fits the needs of the children and families in our community, which is something that makes us unique, that it will be sectioned off by region. So our region won't be the same as a more populated or a much more rural area. It will be complementary to our communities. The Birth to 5 team has already been working and put effort into aligning with organizations and leadership teams that are hard at work in our communities. And there is regional planning underway. This is very exciting as Birth to 5 moves forward. In communities with more localized efforts, once the regional manager is hired and the staff are up and going, they'll build on the collaborations to ensure that they're catching any of the gaps, the barriers, expansion needs, whatever our community might need to move forward. Another exciting part of this is families. Our families that we've been working with for years and years are going to have an opportunity to have a voice at these tables. This is an exciting design for those of us that have worked at families so they can share their voice. It's a hope that Birth to 5 will be seen as part of a community system and an advocate to early childhood education with money tied into it. So there will be a $1 million funding opportunity, which should be launched this spring of 2022 to help collaborations realign and increase enrollment in early childhood programs, especially programs that saw a decrease in enrollment due to the pandemic. As more information comes up on this, we will share that as it's available. Next slide, please. All right, next steps, how to get involved. Both as I mentioned, the Birth to 5 Action Council and Family Councils will be community driven. Birth to 5 is providing the infrastructure and support to ensure there is equitable representation on each of the councils, that we are ready to stand up councils as soon as the community is ready. Now we need all of you and your friends and your colleagues and your coworkers to help us get this going. So if you know people that are interested, refer them to our website, birth5il.com, for interest forms for the Action Council, the Family Council. We really want to increase our awareness and the work that we're doing. So if you or someone you know is interested, please fill out the interest form. These are available in English, Spanish, and Polish, so can meet everyone's needs. Okay, next slide, please. How to get involved. For those of you who are encouraged to apply for one of our open positions, this is very exciting. As the team grows, there are new positions open in the state of Illinois. You can also find those on our website. We're currently in the process of hiring for the 39 regional managers, one in every region of the state. They're also looking for an administrative assistant to join the state team, a data strategist to help with data needs as well at the state level. You can subscribe to the Birth to 5 email communications to stay in the loop, and you can connect with us on social media. Links to the platforms can be found on our website or at the bottom of our emails. This concludes our presentation for this evening. We're now going to transition into question and answer portion for tonight, and we will begin by answering questions that have been submitted to us in advance of tonight's session. And I will turn it over to David.
Thank you. Yes, so we're going to go, like Dana mentioned, over a couple of questions that we've already gotten ahead of time. And I want to start actually with not a question, but just something I wanted to share. We've received several questions already about child development, early childhood educator compensation, childcare assistance, data, program funding. And I just wanted to mention a lot of these things are really not within the purview of the work of Birth to 5 Illinois right now. We encourage you, if you have any of those questions, to visit the Illinois Cares for Kids state, which is the state's early childhood consumer education website. Much more broad, and your questions regarding that might be answered there. Jess will put a link to that website in our chat as well. So I'm going to read through now some of these questions that we have received. So first question I'll go over is, what are the deliverables of the Birth to 5 Action and Family Councils? I briefly went over this in the presentation, but in that year one, councils will be working on connecting and reconnecting families to services pre-pandemic, right? For the state's directive, Birth to 5 Action Councils will deliver a full regional scan, also known as the needs assessment, for the early childhood education care landscape of that region. Now, this is actually by December 2022. This report will be generated in support with the Illinois Action for Children, which is another branch that's going to help build it with the Action Council. So the Family Council will, again, I went through that list, provide everything that's happening, provide that input, provide that parent voice, and together the Action Council, the Family Council will build this report, like I said, by December 2022. So another question we've received is, what is the state of Illinois already doing to encourage parents to take their children to enroll in early childhood programs? So the state is currently running a statewide early childhood awareness and enrollment campaign. This campaign focuses on family and community engagement strategies and promotes the importance of early childhood. This campaign is expected to launch this month. I know we're getting towards the end of the month, but here very soon. As part of this campaign and these efforts, Illinois Cares for Kids, website I mentioned briefly just a second ago, is inviting parents to join Ready for K. Now, what is Ready for K? It's a free research-based text messaging program for families with young children. You could expect to receive about three messages per week with kind of tips and fun facts on how to engage with your child as they grow. You can sign up for this right now. And again, we'll put the link in the chat so that you can go and get more information on it. And my last question I wanted to look at, two more. What is the time frame to stand up these Birth to 5 councils? When can we expect to see some of the implementation of their work? Again, I think we briefly mentioned this in our presentation, but there is no state timeline for these councils, meaning that we're going to move to formalize action and family councils where the staffing positions have been filled and that diverse community members are interested and ready to form part of these councils. So there's no exact timeline for that. We've already gotten some applications for the staffing, that regional staffer. So as we hire them, we're going to kind of start moving in the direction with those particular regions. We're providing the infrastructure, right, the framework, but really then we're leaving it up to the different communities to kind of come together and build it at the pace that they're ready to go. Another question, and I believe this is my last, why is the data on your website that you shared during the February kickoff events outdated? Okay, so in our February kickoff, if you were able to attend those, a lot of the information, a lot of the data that we collected from there was from ICAM, the Illinois Early Childhood Assessment Map. That ICAM does not have up to the date, up to the minute information. A lot of that information comes by fiscal year, by end of year. So it could even be up to a year or two behind or delayed from what might actually be happening, what you might be seeing in your region. This is why the work of Birth to 5 Illinois is so important. This is exactly why we need these action councils and these family councils. This is going to give us context for the data. This is going to make sense of all that data. And we're going to be able to measure data really day by day, right? We're going to hear what's happening throughout the different regions as it's happening. And it's just going to give us a lot better information to make decisions on a state level. So again, I just wanted to close with that because that's the whole reason, not the only reason, but one of the most important reasons why this work is so important. We want to hear what's happening. This is going to create that avenue to be able to do that. I believe now that was my last question. Let me look here. Yep. So we want to open it up now to any other questions that you might have.
Thanks, David. We haven't gotten any yet. Y'all are welcome to use the Q&A box on the bottom to type your questions directly into there, or you can raise your hand, click the raise hand button, and we will unmute you if you want to ask your question out loud. We'll give folks a couple minutes to go ahead and do that. And I think Cicely might have some numbers to share with you.
Yeah, I do. So tonight we have Region 39 and Region 17 on the call. So for Region 39, we only have one applicant or one person who's filled out the interest form for the Action Council and done for the family. And so as you all now have attended tonight, might have more information you can share with people. Please encourage folks to do that. This is not an interest form that's meant to deter people. We know that people have mentioned that it has a lot of questions, but we're trying to do our best to make sure we understand who people are. We're not doing any kind of interview or anything like that. And so we're using this to understand who people are. And as David mentioned, we want to balance the councils. And so this isn't the kind of form in which, if you don't have an answer that you're out. We're not looking for the best answers. We're just trying to balance so we have a mix of not only all the diversity, but some people who are new to advocacy, some who have been advocating for a while. And so that's a way for us to do this without actually having met people. Region 17 has, like I said, 4 for Action Council forms and 0 for family. And so we are really looking for the community to invest their time here and to see the value here. And then the staff that we bring in can kind of walk you through all the steps that we talked about with Action for Children to get that end goal for this year, which is that regional scan. And so this can't be done without you all. I just will answer this question because I know we've gotten it. If there is not any interest in having an Action Council, what will happen in the region? And so we have a clear task from the state to make sure that each region is represented. So David and Dina and the family engagement team will do the family engagement piece, and then our staff will work from the state office along with probably our area coordinators to capture the rest of the information with Action for Children. So there will be a scan that's still done. Unfortunately, it won't be as intensive because we won't have the narrative of family provider and community voice to really help us fill in those gaps. So we do want you all to join. We want others to join so that the scan that comes forward so the state can understand really what's happening from your perspective, not from our perspective, since we're not in the community. I also will add in there that we've had a few applicants for the positions for this region, these 2 regions, but we're also open to more. It's still online if you want to share that or you want to think about applying yourself. Once we get those regional council managers, they will begin the work of not only pulling the councils together, but also hiring for that family and community engagement staff in the region, as well as the admin data staff in the region. So there's lots of work to be done. There's lots of support from the state office, but we really want to partner with you. So we need folks who can really consider signing up for the councils.
Thank you, Cicely. I'm still not seeing any questions. So I know Dana might have some other things she wanted to add. And if no questions come in, we'll go ahead and wrap up after that.
I was going to add a lot of what I said on the slides. Please refer people to be involved with us. We are looking for members of our communities to step up and be engaged at on either the action counselors or the family councils, as well as the positions as Cecily just mentioned. If you have questions or have groups that I can talk to or meet with, please send them my way. Send me an email. I know Jess dropped that in the chat a little bit ago. I'm happy to meet with people or talk to you individually to answer any questions that you have. So go out and be our cheerleaders, everybody. We need more people.
Yes, thank you. Armand, we can go ahead and pull up those last couple slides. We'll start closing out, but if you end up thinking of a question, definitely still go ahead and type that in or raise your hand and we'll get to you.
Here are all the links you need to get involved. They're on our website. They've been in the chat. Again, our website is in English, Spanish, and Polish. If that is an obstacle, or excuse me, if that's a need that people have for language accessibility, we will post this video later in the week, and so you can share that as well. If you're not on our mailing list, please do that. You can do that through our website as well. And just, yeah, please reach out to Dana or to us if you have more questions or clarifications. That's what we're spending most of our time doing, and we understand this is a new concept. And so people have lots of questions and concerns. We want to make ourselves available, but really we want to make sure that we understand, we on our team, not only with the state team, as well as the region understands what's happening in your community. We want to make sure that what's happening and what's needed comes from you all in the community. So we are here. We're happy to join you and partner with you. And we're happy to also start small. And so I know David mentioned about 14 or 15 positions or perspectives we're looking to have on these councils. But if we have 5, we start with 5 and we build from there. So please don't let any of that deter you. We're giving this information out to motivate you to join, but also to clarify what we're trying to do.
Thank you so much. I'm not seeing any other questions. And so with that, we hope you all enjoy the rest of your night. I still have some sunlight left for the day, so maybe get some last seconds of sunshine. Thank you
Yes,
all.
thank you all for coming.
Thank you.